let's imagine for a minute that you are an athlete on a football team and you're in the fourth quarter of a semifinal match. You are holding off the opposing offense near the midfield and you break through the O-line, making a big sack, forcing the fourth down. This big play has not come free though. You, after the play, have a hard time getting back up. You feel rather dizzy and hear a ringing in your ears. But this is the playoffs, and you want to shake it off and keep playing. However, your athletic trainer makes a different call and pulls you off the field, suspecting you have a concussion. Obviously, you're disappointed, but what you may not realize at the time is that this athletic trainer is saving you from some serious further harm from brain trauma known as a concussion. In this speech, I'd like to persuade you to take action in preventing and protecting from concussions. First, by showing you what a concussion is and how they are evaluated and treated by physicians, and also giving you some small things that you can do to help prevent them. So what is a concussion? According to the Premier Health Network of Ohio, a concussion is a brain trauma, usually mild, that results from a direct blow to the head or a blow to the body that causes a whiplash or rotational type of injury to the head, hand, or neck. This usually results in a temporary alteration in mental status and does not usually result in a loss of consciousness, though in most severe cases it can. So, these things happen a lot more often than you would think. An estimated 300,000 sports-related traumatic brain injuries are reported in the state of Ohio every year, second only to the amount of brain trauma caused by car accidents. So how would you be able to tell if you have a concussion? Some of the more common side effects include ringing in the ears, headache, or disorientation. More severe side effects can be nausea, vomiting, and in most severe, personality change, permanent brain damage, and in most severe cases, paralysis. But these side effects usually occur right as the injury has happened. But one of the more frightening things is the side effects that develop as you move on in your life. As far as lasting side effects, in most cases after a concussion, an athlete has irregular brain wave patterns which can result in a lack of attention. In a few cases where they studied older athletes who had had a concussion early on in their careers, these athletes had developed symptoms that were similar to those seen in patients of Parkinson's disease. These athletes also showed an severe attention and memory deficit. So, for evaluation of these concussions, most physicians and physical trainers have a common form such as this that they use. Once they suspect that you have had one, they go through this test, which tests, as you can see, orientation, immediate memory, concentration, and recall. This test is an important step in the OHSAA Return to Play protocol, which states, if a concussion is suspected by the coach, athletic trainer, or referee, the athlete is not allowed to return until they're assessed by either a physician or a licensed healthcare provider using that form which I just showed you, and then they must receive authorization written by that physician. Even if you did not actually receive a concussion, but you are still suspected of it, you still have to go through all this testing and signing off before you're allowed to play again. If, however, you do have a concussion, the process is much more complicated. You still have to go through the assessment stage the same as everyone else, but you are not allowed to return to play until you have gone through a certain rest period, which is usually several weeks, and then you must be watched by a physical trainer and slowly built up back to the level of play. This can take weeks or maybe even months. So now that we know a bit about concussions and how they're evaluated, let's look at some simple ways in which you can help to prevent them. If you are an athlete, always wear well-fitting and gear appropriate to your sport. If it doesn't fit, it won't really do anything for you, so make sure you have the right stuff. If you suspect you may have received a concussion, then you must seek help immediately. Be honest to your coach and your athletic trainer, because they're there to help you. You must also allow your body a certain time to recover before jumping back into the sport, as this may cause you more harm. If someone you know suspects to have a concussion themselves, do what you can to encourage them to go and seek medical help before they allow the issue to get out of hand. In conclusion, now that you know exactly what a concussion is and how it is treated, I hope that you have been persuaded to take action and do your part in helping prevent and identify these serious brain injuries.